Hey Nation, it's favorite nurse Jasmine. I'm back today with another video. So today's video is actually going to be a Q&A. I asked you guys some questions over on the gram, as well as I made a post here over on my YouTube channel. Told you guys to leave questions, and yeah, I'm going to answer them. I didn't vlog any this week, so instead of a Sunday vlog, you guys are going to get a Sunday Q&A. I'm trying to answer as many questions as I can, and if I don't answer your question, maybe we could talk about doing a Instagram live maybe. So that way you guys can answer me some questions. We'll set a time and date and all that other stuff in advance. Just to make sure that everybody can participate if that is something that you guys are interested in. So if you are, definitely let me know. But like I said, I'm going to try to get through all of these questions today. So let's just get into it so that the video isn't longer than what it needs to be. Okay, so we're going to start with Instagram questions first. I am going to be looking down at my phone, so I hope that doesn't bother you guys. But like I said, I'm going to try to get through as many questions as I can. So the first question comes from Lex.Lex. And she asks, how hard is microbiology and what tips and tricks do you have for that specific subject? I actually love microbiology. I did my micro class completely online. Even my lab was online, and we did like experiments and all that other stuff. I feel like microbiology was super like crazy easy. I don't know if it's just because I liked it. I feel like it was super easy and it was super fun. But my biggest tip for any topic, any subject, is to not procrastinate. Get a head start on every assignment as much in advance, so that way if you do hit like a roadblock, it's easier to get in touch with your instructor and ask for help. So yeah, but honestly I thought micro was easy. Okay, so the next question, oh my god, I do not want to butcher your name, so I'm going to put it up here in the screen. And she says, did you remember everything you studied when you finished school? No. I didn't. I mean, you remember some stuff, but, and I'll say that as far as, yes, a lot of the stuff still applies, but most of the time you will hear like your instructors or your preceptors or somebody say, well, I know this is what the book says and how this is done, but this is how we do it here. So a lot of the stuff changes once you actually get into the real world. Now, making an occupied bed, I'm so boss at that now. And then the same person also asks, after finishing school, how is an area of specialization chosen? That is completely up to you. It is dependent on what you want to do. It's all about where you apply, who offers you an interview, and then once you go on the interview, if you nail the interview, then they'll hire you. I do have a video on how to do your resume, how to do your interview, and I'll link both of those videos down below. But ultimately, your specialty is based on what you personally want to do. Okay, so Miss_Toya says, what shift do you prefer? I still honestly prefer day shift, even though I have come to like night shift. I still prefer day shift. Okay, Queen Love 26 asks, what do you think is best to work at when you get out of school? I think that is up to you. Everybody is different. What you may like, somebody else might not like. So you have to choose an area that you think suits you and your personality. So Kita V79 asks, as a new nursing graduate, did you start out in med-surg? If not, do you recommend it? I did not start out in med-surg. I refused to work on a med-surg floor. That is just me personally. I knew after clinicals that I did not want to work on med-surg. There's absolutely nothing wrong with working med-surg. We need awesome med-surg nurses as well. I just knew for my personality type, it is not what I wanted to do. So I recommend you do whatever you want to do. Again, you have to choose a specialty that you feel is you. And if you feel like you don't know what specialty you want to go in and you want to get like your time management down, prioritization down, then I would definitely suggest med-surg. But ultimately, I just knew med-surg was not for me. She also says, how did you feel about med-surg? I get mixed reviews about that class. I hated med-surg class, and I was so glad when we got out of it. Surprisingly, my favorite class was mental health. So Hannah7 asks, I hope I'm saying that right. Is it normal to have second thoughts while in school? Absolutely. I think a lot of us did, especially when you hit subjects that is super hard, or if you're doing back-to-back clinicals and it's areas that you don't like. You're like, oh my god, what am I doing? Why am I doing this? I think it's completely normal to have second thoughts, as long as you're not like almost done with the program and you're like, oh my god, I know I'm gonna hate this, I know I'm not gonna want to do this, then if you come to that point, then I would suggest you not do nursing. So I took a screenshot of this question. It doesn't have a name, and it says, how do you know if a nursing specialty is for you, like ICU, ER, OR? So that is, you get a feel of each specialty while you're in clinicals. Hopefully the school that you go to allow you to hit every single area. Our school was really big on that, and that's one of the reasons why I chose a private school, and I was very happy to get experience or get like a little bitty taste of every area, because initially I thought I was going to go into one area, and then when I ended up in ICU, I was like, nope, this is where I want to be, this is what I want to do, this is for me. And that's ultimately how you choose. Okay, Miss Essence 727, she asks, what does your first year survival as a nurse book do exactly? I'm curious how it can assist you as a new nurse. Okay, so for all of you who do not know, I do have a ebook or an e-guide that is available for purchase, and I'll leave the link below in each description box every video. So basically what it does, it's going to be emailed, once you purchase it, it's emailed to you as a PDF, and it breaks down everything you need to know during the first year. It gives you templates, it gives you multiple reports that you can use. It basically lets you know from dating within the hospital to how to show up on your first day, things you need to bring. It also gives you tips and tricks on how to get certain stains out of your scrubs. So it touched base on every single thing, and it's everything during the first year of nursing that I wish someone would have told me, that would have made my transition a lot easier. And I put it all into an e-guide for new grads, and if you want to purchase it, once again, the link is below. You buy it, and then a PDF is emailed to your address, the email address that you use to purchase. So I highly suggest it. If you're a new grad, like, you need it. You need it, honey. Duchess 1618 said, do you know of any great medical study apps that I can use for on the go? So my school had ATI. We used ATI, and there was an app that we were able to download. So I did ATI questions on the go. And then the other app that I really used during nursing school was just the drugs app, which is actually drugs app. And that was for all my pharmacology things. But other than that, I recorded my lectures on my phone. So I listened to lectures on the go, and then I used ATI on the go. But that's all that I used to study. So the Bevelins Photography asks, are you still fazed by death? I am no longer fazed by death. I have been in the ICU for so long. It's very common for deaths to occur. Some expected, some not. And they really don't faze me either way now. So she also asks, what specialty would you switch to? So I would definitely do oncology, hematology, and I would work with disabled kids. So E_J_Beauty_ asks, was school hard? Hell yes. By far the hardest thing I had to do ever in life. So Queen Love 26 says, what do you think is best to work at when you get out of nursing school? So this seems to be a common question, and like I said, once again, it all is dependent on you. There's no right or wrong way to go into a specialty once you get out of school. Don't let anybody tell you have to go med surg, because you don't. Ultimately, you just have to choose what you want to do. Okay, so BBC.XX says, did you start in the IC as a new grad? Yes, I did. Fresh out of school, got that job. So Kiera_plans asks, your personal opinion, the differences between a PA and an MP, and what made you choose MP? Honestly, I don't really know much about PA, and that's just being 100% real with you guys. I knew I didn't want to go that route just because I was already planning on being a nurse first. I actually wasn't planning on going back to get my MP, but I will explain to you guys why I chose to go back for my MP. It's going to take way too long to explain that in this video, but ultimately I chose MP because I was already a nurse. So I was already a registered nurse, so it wouldn't make sense for me to go from registered nurse to PA instead of going from registered nurse to MP. So Car_Bear12 says, hi Jasmine, thanks for doing a Q&A. You're welcome. She said, what is your favorite thing about nursing and why? My favorite thing about nursing is that you get to help so many people from all walks of life, whether they're rich, poor, speak English, know English, barely turn 18, 102. I mean, you get to help so many people, and I can definitely say when you get patients in the ICU that you think are not going to survive and they end up walking out of there, best feeling ever. So Jewel Tricks 8 asks, how did I care for a hurt ankle? I think she means how do I care for a hurt ankle? I'm not orthopedic, I'm not rehab or anything like that. If your ankle has been hurting you for a long period of time, regardless if you are, you know, elevating it, using ice, resting, using some kind of compression, so if you're using rice and it's not working, I definitely recommend you go see your doctor, because it could be fractured. I don't know what you did to it. So Call Me MJ, she said, what is your favorite thing about nursing? And I just told you guys that. And what is your most hated thing about nursing? My most hated thing about nursing is most definitely staffing. Usually always sucks, and sometimes you get patients that are not technically ICU patients, and they think that they're kind of like in a hotel and they want you to be their maid and they want you to do stuff that's not while they're in the hospital, for like fluff pillows and things like that. So stuff like that, it's like they want you to be at their beck and call. So those are probably my two most not hated things, but I don't like that. I don't like that part. So Brittany Vlogs asks, how do you deal with lazy coworkers that don't feel that they need to do their part? So this can go two ways. If they're lazy and it does not affect you, you do not have to address it. I have learned that you cannot correct everybody. You can't make everybody have the same work ethic as you. So if it's not directly affecting you, your patients, your patient care, and it's not harming any patients and putting their life in danger, don't address it. Now, if you are seeing their behavior that ultimately is like not giving your patients quality care, like not doing their job at all, like nothing is being done, no charting is being done, no meds are being passed, patients are being neglected, patients are being left in poop all night or all day, and if it's things like that, then that's something that definitely needs to go through your chain of command, which is basically like your management. At first you can address it with them calmly, and be like, hey, you know, do you need some help, or are you behind? You know, try to kind of do it in that way. But if that does not work, then definitely just take it to like your DON or your nurse supervisor, charge nurse, whoever, you know, whoever's around. The next question is also about Call Me MJ. Best work sneakers for nursing. PS, love your channel. Thank you for watching. Thank you for supporting. I love my channel too. No, I'm joking. But seriously, best sneakers are Nike Rochers. I absolutely love them. Recommend them to anybody. I have very wide feet, very wide fat feet. Dance goals hurt my feet so bad. So when I started wearing Nike Rochers and I felt like how much I can move in them, how comfortable they are, and they're the material that if you get anything on them, you can easily throw them in your washing machine and wash them. It is amazing. So definitely Nike Rochers, and a lot of the times they're on sale. Love Monica asks, in nursing school, did you use ATI or HESI, and how did you study for them? And like I told you, I used ATI, and we had the program on our computer that gave you a bajillion questions with a trillion rationales on why things are right or why they're wrong, and that's what I did. I also put the app on my phone and I studied on the go. And we didn't use HESI, so I can't recommend anything for that. The next question is, I'm currently pulling a C every semester. What are things that has helped you? Okay, so if you, first of all, C's get degrees. Second of all, if you are finding yourself struggling, first ask your professor if you can get some tutor time. See if how you're studying is not effective for the way that they're testing. And the next thing is find somebody in the class that is actually doing really well and ask them for a study group. A lot of people have different study techniques. I was a big fan of study groups, small study groups, but study groups where you're hearing how other people are interpreting the information. Sometimes it clicks better in your head. So those would be the things that I recommend. But girl, C's get degrees. Monette Day asks, I always see good veins in the feet. Is starting IVs down there? No. It depends. So if you are starting IVs for like maintenance fluids, antibiotics, PRN meds, do not go in their feet. First of all, it hurts. Especially if they have good veins other places. Now, the only time we will start IVs in the feet is if we have no IV access, there's no doctor around to drop a central line, and our patient is about to die. So, are they going to die? You're going to drop something in their foot. 20 gauge, 18 gauge in the foot, and you push meds as fast as you can to make sure that they don't die. But ultimately, honestly, you don't want to just go for someone's foot. Like, it hurts. Don't do that. Christina Walter 91 asks, have you ever felt a plan of care was incorrect? If so, how did you go about stating your opinion? I'm very opinionated, and that comes with time. But ultimately, I can't change what a doctor feels is appropriate for that patient. But if I notice something, I will bring it to his or her attention, like, hey, I know you're ordering all this stuff for the patient, but I've heard patient family, they're talking that she doesn't want any treatment, she just wants to go home. Have you thought about maybe talking to them about CMO or hospice? So you just try to say it nicely. Don't go in there with an attitude, but also be an advocate for your patients. Like, that's what we're here to do. So now we're gonna go into YouTube questions, and there's a lot. So like I said, I'm gonna try to get through all of them, y'all. This might be a long video, but we're gonna get through as many as we can. Okay, so the first question is from Amia Bell. I hope I'm saying that right. Amia, that's a pretty name if I am saying it right. How did you become confident as a nurse? I'm looking into nursing, but I keep getting scared away because I don't know if I will be good and confident as other nurses. Putting someone else's life in your hands can be scary. Plus, I have no background in the medical field. Will clinicals help me build confidence and get comfortable? No. You will build confidence and get comfortable as you do it. So clinicals is kind of a way for you to fuck up and have somebody else to blame, or to be like, I have no idea how to do anything, teach me. That's kind of what clinicals is about. But it's not going to give you confidence, because if anything, it'll make you feel dumber, to be honest, because you're like, I should know how to prime an IV tubing. I should know how to remove a Foley. But those things are very difficult when you're first starting out. And gaining confidence as a nurse, it comes with time, it comes with experience, it comes with doing and seeing the same things over and over, and knowing what is wrong, what is correct, what should be addressed, what is not a big deal. And honestly, I am a firm believer in fake it till you make it, until you get all the confidence in the world. Now, don't go in like acting like you know it all. Definitely be humble, ask for help when you don't know things, but eventually the confidence will come. It is something very scary, but you got to make sure nursing is something that you want to do, because it is a lot of responsibility. You have a lot of things that is relied on you. So make sure it's something that you really want to do before you do it. Carrie Ann asks, did you find that it was easy to get into the ICU as a new grad? If not, what steps did you take to get into the specialization? Thanks. I thought it was very easy. Like I said, when I did my ICU clinicals, that's actually where I got hired at. I had to end up getting us an ICU job in an area that not a lot of people wanted to work in. A lot of homeless, a lot of immigrants, not a lot of resources, but I got the best experience that anybody could ask for. So I would just say, sometimes you might have to apply to hospitals that you don't necessarily want to work at, or that's not paying as much, in order to get the experience. And then once you get the experience behind you, you can negotiate the money, and you can definitely get hired at any hospital that you want to get hired at. Simple as that. Kim D asks, top 3 tips of being successful in nursing school. Study, ask questions, study. LaQuisha Lachey says, I have been a nurse for a few years and I have dealt with a lot of racism with patients. Have you encountered the same? How do you feel about a patient that prefers a nurse of a different race? So I actually have a whole video on that. That could be a long drawn out topic as well. So I do have an experience time where I actually tell you guys what I've experienced and how I dealt with it. So I'll link that video below. Just click it. It'll be in the description box. And I'm sorry you have to deal with that. Tiffany Love, that's a cute last name. I don't know if that's your real last name, but it's cute. She said, I'm not sure if every school has it, but we have to do an exit HESI exam to pass each semester. Did you use any books to study for it? How did you set up for studying? Because I feel like the HESI is just so broad. I did not have to use HESI to leave out of every subject. We actually used ATI, and we did ATI exams, and it was a portion of your grade. So I don't really have any tips for that. I'm sorry. Marie A. Dene. She says, I'm in LPN school, and if all goes well, I graduate this winter. Afterwards, I plan to pursue my RN BSN. What areas in nursing pays LPNs the most? Honestly, nursing homes pay the most. If you're going for money purposes solely, I would say go nursing home, because nursing home, home health, that's where you're going to get the best bang for your buck. Let's be honest. Would I suggest you go nursing home? No. If you can get into the hospital as an inpatient hospital, or like an inpatient LTAC, I would suggest that. But if you want to know what pays more, and if it's all about the money to you, you better go knocking at nursing home's door, and believe me, they'll open them wide, because a lot of people don't want to risk their license. Miss Tay RN says, okay, so whoever Danny is, I second all of those questions. I'm currently an RN and going for my RN, BSN, MSN, and eventually my MP. Would love to know why FNP, especially since you work in the ICU. What was your motivation behind the choice? Like I said, I'll do a complete video behind that, but just to kind of sum a little bit up for it, since a lot of you guys do have those questions, basically FNP is so broad, and acute care nurse practitioner is so limited. I have to stay at the bedside. Most of the time you're staying in ICU, ER environments, and that's not what I want to do. And I will explain why in another video, because it will be quite a lengthy video as well. But Jada B said, would you recommend taking the LPN/LVN route, or for someone to go straight into RN? It all depends on your situation. If you are able to go straight for RN, I say why not. If financially it is more beneficial for your family to do LPN, and while you work you can go do LPN to RN bridge, and then while you're working as an RN you can then go do your BSN. Everything can be done in steps. There's no rush to one or the other. It's just if you do LPN and RN and ultimately your goal is to become an RN, don't get complacent in that position, because you can move up the ladder as an LPN, but you have to always remember your goal. If you want to be an LPN, you know, until you retire, that's absolutely fine as well. It's just you have to decide what your goal is, and financially how you can do it with your family situation. Miss Angie said, do you like working night shifts? Would you ever go back to day shift? Yes, I would go back to day shift. I like working nights. It's a lot slower pace, but when things hit the fan, there's not really a lot of assistance from like doctors and stuff. You know, they all at home sleep. So there are some benefits to night shift that I really love, and I wish I could take the day shift, but ultimately I like day shift better. Danny asks, what do you do as a doctor that you can't do as an NP? How do they differ? Well, first of all, doctors are physicians. Nurse practitioners are nurse practitioners. So doctors diagnose and treat acute issues, like things that are just coming up, whereas nurse practitioners, they treat more of chronic pains and illnesses. We all can order tests. If I'm correct, I think referrals actually have to be signed off by a doctor, but could be given by a nurse. Some clinics require the patient to see the doctor first, and then the nurse to see them for all follow-up visits. And then there's a lot of states where doctors, where nurse practitioners have to work under doctors. So, child, the number of years you go to school, the amount that you get paid, it's a big difference. Do you want to have your own practice as an FNP? No. Why FNP and why not a GACNP program? Blah, blah, blah. No, like I said, I'll explain that in another video because it will be too long for this, but I will have that video coming up for you guys next week, I promise. Do you ever wish you had gone the doctor or PA route? I've never once wanted to become a PA, and still to this day, no desire, not even mentioned in the forefront of my frontal lobe that I wanted to be a PA. No shade, no tea. It's just I've never wanted to be a PA. Sometimes I wish if I was in a different circumstance when I was younger, I would have just said F it and went to school to be a doctor, and I would have wanted to be a pulmonologist, but so is life. Toya Jackson, routine at work, working night shift. Go to sleep at 4 to like 5 o'clock in the morning, wake up around 1:30, 2ish in the afternoon, 3 if I'm super tired. Wake up, work out, eat, shower, chill, watch a little bit of Netflix, do my hair, put on scrubs, pack all my stuff in my car, go to work, come home, shower, go to sleep, and then do it all again if I have to work the next day. Coco Walker asks, do you recommend someone who recently graduated from high school to take their prereqs at a community college, then transfer in, or should they start at a 4-year university just to stay focused? It is completely up to you. Financially, it is so much cheaper, especially if you have to do student loans, to go through a community college first and then transfer from a community college to a 4-year college, or go the ADN route, whatever is more feasible for you, than going to a 4-year college. But there are some people out there that is absolutely like persistent that you need to go to a 4-year college and just get it all done and just get your BSN done. But like I said, everybody's situation is different. Me, I think going to a community college and getting my prereqs was the best thing I could have done, because although I do have a lot of student loan debt, it is nowhere close to some of the people and some of the nurses that I've talked to that went straight directly through a 4-year program without any help from mommy and daddy. So Nella loves you. She said, do you have any anxiety regarding nursing? How do you feel about labor and delivery? What do you think is the least stressful nursing job? How do I have any anxiety regarding nursing? My very first year, I used to cry before every shift. It was horrible. Very stressful, very hard job. It was just a lot, and nursing is very tough on you mentally and physically. So yes, I did, and now it's normal to me. So I don't have that issue. I actually wanted to be an L&D nurse when I first went into nursing. I was like, I'm gonna be an L&D nurse. Then I did clinicals and I was like, I'm not gonna be an L&D nurse. That is not for me. It wasn't. But I think it is all up to who you are. If you love that, then you will love nursing. You will love L&D. What do I think is the least stressful nursing job? I absolutely have no idea, because I've only worked ICU. But I would think of anything maybe doing the clinical side, like as far as like case management and things like that. I think that would be least stressful than actually patient care. And then on the patient care side, maybe home health. Amia Bell said, will you get used to stomaching vomit blood? Do you have any friends who had weak stomachs that got used to it? Honestly, we all like that stuff, even during nursing school. If you're bleeding, we're in the room with you. So I never really had that issue. I'm not a big vomiting person. When someone's intubated and they vomit, I still don't have the stomach for that. I can handle it, but it's not my favorite. Monique M says, would you ever consider doing a full head-to-toe assessment? After I'm done with my BSN, I would like to pursue my MP. Is there any programs online that might be good programs? What are some great ways that you take notes? So a complete head-to-toe assessment, I don't know. Maybe I'll see if like my husband will be into that. I don't know. We'll see. Before I came to New York, I was actually going to do my entire program online. Do my top 3 in the order. So number 1, I was going to go to UTA, University of Texas at Arlington. That's what I got my BSN from, and I've heard amazing things from the program, as well as a lot of the doctors that I worked with actually had preceptor qualifications, like they were working with the school, so a lot of them were like, you can just follow me. So that was like my number 1 pick. My number 2 pick would have been Walden University. They're hella expensive, but I heard it's a really good program. Some of the girls that I worked with actually went through that program. Number 3 was going to be Texas Tech, and that was just because I have seen pictures of their simulation lab, and it is so boss. Like, oh my gosh, I would love to just do one day there. So those were my top 3. What are some great ways to take notes? Don't try to write everything down. Record your lectures, and then you can pick out the bits and pieces that are important. And then break everything down into diagnoses. So whatever the diagnosis is, symptoms and side effects, pharmacology, nutrition, lab tests. Ooh, what else? Yeah, break it down like that. Princess Allison Ben said, what is your motivation to become a nurse? What tips could you share for the upcoming nursings? What could you share about being on top of things in the ER because it's hectic? What do you expect to see with trauma patients? What medications do you use the most? What are your duties? Okay, so I'm not going to do this from an ER perspective because I don't like working in the ER. I've done shifts in the ER, but it's for ICU holders, and ER is just not my thing. So I'm going to do this from an ICU perspective. I did a complete video on why I became a nurse. I'll link that below. You have to want to be a nurse. It has to be a passion of yours. You can't just do it just to say I'm a nurse. What tips could you share for upcoming nurses? Your first year is going to be your hardest year. Everything after that gets easy. But what could you share about being on top of things in the ER? So I'm going to say being on top of things in the ICU, prioritization. Know your patients head to toe. Know every single thing about them without looking at a piece of paper. Go over your history physicals. Know your labs. Know everything. Know where your IVs are. Know what things are running. Know what they're running at. I know everything about my patients, even their families. That is a question that I ask in the report. What could you expect to see with trauma patients? Blood. A lot of blood. A lot of chaos. A lot of people yelling. You just have to focus. What medications do you use the most? In the ICU, we use we use a lot of propofol, a lot of Versed, a lot of Levo, a lot of Vaso, a lot of Carthage. When you're intubating, you're using etomidate, Vec, Rock, Sux, depending on whoever the doc is. Yeah, those are kind of morphine, Dilaudid, things like that. Thyroid, levothyroxine, that's like everybody takes levothyroxine. And what are your duties? Everything, making sure your patient stays alive. We don't have AIDS, so we do everything. Cynthia OR, hey girl, you trying to be in the OR? Okay, I see you. So she says, does LPN school involve a lot of math and how hard is it really? I don't know. I didn't go to school for LVN first. But as far as math, it's like not algebra or geometry. It's just your basic adding, subtracting, multiplying, dividing, converting. It's a lot of pounds into kilograms, a lot of milligrams, a lot of milliliters. If you're working with kids, it's a lot of converting. But math is really not that hard. And I am a person, I suck at math. It's my least favorite subject. I always do the worst in math. So the math isn't that hard. What are your thoughts on being an LPN first? If that has to be your first stepping stone, I highly recommend it. You get a lot of experience as an LPN. And LPN still can work in some hospitals, not all hospitals, and they take patients just like we do. You just can't take a new admission. Takeisha Harris said, how did you know you wanted to become a nurse? Like I said, I did a video on that and I'll link it below. What is some advice you would give someone who's indecisive about becoming a nurse? If you're indecisive, don't do it. If you are not 100% sure that this is what you want to do, nursing is a harsh, rough world. It is a hard career. And if you are not sure that you want to do it and you're like, I kind of want to be a nurse because of it's a stable career and you get paid, don't do it. If you don't have a passion for it, don't do it. It will eat you up, swallow you whole, and spit you out. Jalissa McLean said, what are some good study tips, habits you would recommend? I feel like studying nursing school will be more difficult than how I have to study for my prereqs. Absolutely, yes it is, honey girl. It is no comparison. You have to do a lot of studying, a lot of reading. If you're like me, record lectures, study for short bursts of time, take breaks in between. That helps a lot. So those are my tips. But definitely do not procrastinate. Study ahead. Read as much as you can. But yeah, if you're still doing prereqs, you have no idea how much the studying is going to change. Angelita Charlie said, when you work as a nurse, is it completely different from nursing school, or do they somewhat collide together as one? Is doing the job different from what people make nursing school seem like? It comes all together once you're out in the real world. So when you're in nursing school, it's broken up into pieces. It's like they feed you little baby bits at a time. Like, oh, you know, clean the patient this semester. Second semester, oh, you know, take a Foley out, put a bedpan on. Oh, you know, next semester, let's practice some IVs and putting on sterile gloves. And then, you know, it's like they feed you little bits and pieces. So when you actually start working in the nursing world and in the real world, everything comes together and it just kind of, they collide together. But it becomes as one, it becomes more fluid. But let me just tell you, all the stuff that you're supposed to do in nursing school, you don't do that once you become a nurse. Courtney ETC said, I'm currently doing my prereqs, but sometimes I get terrible anxiety about beginning the journey. Is that normal? Yes. You're gonna have a lot of anxiety while you're in nursing school. It is fine. It's okay. It's normal. Everyone has it. Kim D said, what other careers could you see yourself pursuing other than nursing or being a YouTuber? A YouTuber is a hobby for me. I don't get paid a lot of money from this. I have no sponsors and things like that, and I don't have a large following, so this is completely a hobby. Nursing is going to be my only career. I couldn't see myself really doing anything else. Before this, I was like, oh, I could do hair. I would love to do hair. My mom did hair, and I love hair. So I was thinking about doing cosmetology school, and that would probably be the only other thing I would ever be interested in. Lila Rosado said, should I start my nursing internship during my last semester or a year early before I graduate, and will this internship help me on the NCLEX? I'm not sure what school requires you to do an internship your last semester. You should just be required to do clinical hours, but none of that helps you with NCLEX. You have to study for NCLEX, and it's hard. Miss Angie said, why did you choose your current MP school versus 100% online? Because I'm in New York and it was the only option that I had, and that's why I applied to one school and one school only, and thank God I got in. New York has their own rules and I hate them all. Danny asks, if you could go anywhere in the world, where would it be and why? If I could go anywhere to live, I would go back to San Antonio because I love San Antonio. It has definitely become home. Even though Oklahoma is home, technically San Antonio is like in my heart, and I cannot wait to go back. But to travel, I would definitely want to go to Bora Bora. I love being just in the water, in clear blue water, and just with peace, meditation, calmness, positive vibes. Me and the husband and the kids, if they cannot fight every 2 seconds, that would definitely be it. Next question. The last question is, would you ever consider being a nurse in the military? Why or why not? I hear the benefits are good for RNs in the military. Yes, I would consider it. It is something that I've been considering once I'm done with my MP, and it's for a lot of reasons. I will do a video completely talking about that, just because it will be kind of long and drawn out. But yes, it has been something that I've been considering. It is a possibility, a very big possibility in my life, and like I said, I'll address that in the upcoming video as well. So you guys, you look at y'all act like y'all know me and stuff. Alright, so that sums up this Q&A. It was a lot of questions. I know some of them I did not give you guys answer to because I have videos gonna touch on each of those topics. Thank you for sticking around. I don't know how long this video is. I might have to break it up in 2 pieces because you guys asked a lot of questions, and like I said, I was determined to answer all of them since I did not give you guys a vlog this week. Maybe we can do an Instagram live Q&A talk, touch on a little bit more stuff, kind of us communicating back and forth. If you guys are interested, leave that below, let me know. If you're not subscribed and you're new here, definitely subscribe, join G Nation, as well as follow me on the gram and on Snap. And yeah, turn on your notification bell. Until the next video, I love all you honeys. Bye.
That's all I'm trying to do. Hustle and motivate. Choppers a throwaway. Hustle the overweight.